Dear viewers, we measure several pressure during invasive mechanical ventilation. The aim of measuring these pressure variables is to understand the underlying pulmonary condition, to avoid barotrauma, and to adjust PEEP. In our last video, I discussed driving pressure. Though driving pressure is a reliable pressure variable and based on sound physiological principle to determine appropriate tidal volume in heterogeneously involved lung in ARDS patient, it becomes less relevant in patients with the poor chest wall compliance like patients who are obese, patients with abdominal hypertension, and pregnant patient. In such patients, transpulmonary pressure seems to be a more appropriate parameter. While ventilator screen reflects the value of peak airway pressure, plateau pressure is measured during inspiratory hold maneuver or during inspiratory pause when the flow is zero. Driving pressure is derived by subtracting the PEEP from the plateau pressure, and transpulmonary pressure measurement is somewhat invasive since it requires esophageal pressure monitoring. In this video, I am going to discuss about transpulmonary pressure. I am Dr. Sunil Garg from Essentials of Acute Care. Transpulmonary pressure by definition is the net distending pressure or the pressure needed to keep lung open, and it is a difference between alveolar pressure and pleural pressure. What is the significance of transpulmonary pressure? Transpulmonary pressure determines the influence of chest wall on airway pressure. So transpulmonary pressure is the pressure which is delivered to the lung and required to keep the lung open, and it is independent from the effect of chest wall and abdomen on the airway pressure. Conditions that decrease chest wall compliance can increase airway pressure and lead to false impression that lung stress is present or lung stress has increased. In such situations, measuring transpulmonary pressure can more accurately reflect the stress on lung parenchyma, as the measurement is independent of chest wall compliance. So you can ventilate such patients above the accepted airway plateau pressure if transpulmonary pressure remains within normal limit. With regards to its use, essentially with the currently available parameters, transpulmonary pressure most accurately reflects the lung stress and the risk of injury. It is used most frequently in the intensive care unit setting to guide PEEP in most typical patients like patients with ARDS who are morbidly obese or patients of severe hypoxia with intra-abdominal hypertension. Here you can see how you can set ventilatory settings, especially with regards to tidal volume and PEEP, to ensure effective oxygenation and ventilation and to minimize the risk of lung stress and injury. Thanks for watching this video. If you like this video, please subscribe to it. See you in my next video on ventilating ARDS patient. Till then, thanks and bye.